Hello, my name is Karen Horn, and I am the project lead for the Wisconsin School-Based Mental Health Professionals Project. I'm excited to be with you today, particularly because your school district has been selected to take part in this wonderful opportunity. This presentation has been sent to you to discuss this opportunity and discuss the specifics of participation in this project. The School-Based Mental Health Professionals Project overview will provide you with insight into the key components of our participation in the federal grant. We will discuss the priority areas of the grant, the goals, the desired outcomes, current data regarding school-based mental health professionals in schools, both at the national level and as well as here in Wisconsin. We will also discuss how your district was selected and the process we used for this selection, the commitment involved to participate, and finally, the next steps to starting your participation. I am delighted to share that we were selected to be awarded a $10 million grant from the U.S. Department of Education. We are so excited to have been one of 6 states to be provided this wonderful opportunity. And as I mentioned earlier, your district has been selected because of demonstrated need. And I will be diving deeper into how that need was identified in a moment. But first, I wanted to share the focus of the project and our goals of participation. There are 4 key goals that are the focus of this project. In the next 4 years, we are focused on assisting school districts with identified needs in the recruitment and retention of school counselors, school social workers, and school psychologists, with the hope of reducing high student to pupil services staff ratios. This will be accomplished through a twofold process. The first is building an infrastructure with University of Wisconsin Pupil Services programs to increase the training opportunities for those interested in pursuing a school-based mental health profession, and also to increase the number of pupil services staff recruited and retained. We also seek to increase the diversity of these positions so that they're representative of the students and families they serve. This table highlights student to pupil services staff ratios. On the far right column, you will find the state mean, which is based on our YStaff reporting system. Statewide staffing is reported to us annually. The middle column references the average of students to pupil services staff across all states. And the recommended ratio, which you'll find on the far left column, is from our National School-Based Professionals Associations. You will notice when comparing these columns that we are close to the national averages. But when we compare our state mean to the recommended ratio, you will notice that we are significantly higher. These ratios impact the retention and recruitment of school-based mental health professionals, as we know that high student to staff ratios increase compassion fatigue, burnout, and ultimately can create harm for our students and their families. Recommended ratios are intended to ensure that professionals can address student needs effectively. It is important to note that these are generalized ratios, and recommended staff to student ratios are even lower where there is a greater need, such as communities with high levels of poverty, community violence, trauma, or lack of access to mental health services. In many of our communities, the school is the only source of mental health support within reach. And if we've learned anything in the last year and a half, in particular during this pandemic, is that it has highlighted the significant mental health needs of our students across the state. And high student to pupil services professionals ratios inhibits this important work. This is why I'm so excited to share this opportunity with you, because it provides the opportunity to expand school-based mental health services that are so needed in our schools. This slide references the percentage of school-based mental health professionals based on our YStaff reporting. The percent is the total number of school-based mental health professionals by ethnicity versus total ethnic representation by state. As I mentioned earlier, We are really focusing this project on diversifying our school-based mental health staff. This also includes our communities where the number of Native Americans is higher, but representative school-based mental health staffing ratios that serve our Native American students are low and lacking diversity. When looking at these percentages, it illustrates that we have some work to do to ensure that our school-based mental health staff are representative of the students and families we serve across Wisconsin. This brings us to our approach. When we were in the process of writing for this grant, we created a logic model that looked at various barriers to retention and recruitment of school-based mental health professionals. This slide illustrates the primary areas that would help to remove these barriers, which includes working with University of Wisconsin Pupil Services programs to create and expand pathways to licensing. One of these expanded pathways are virtual programming, so that students that live in rural areas are able to access these training programs, even if they don't live near one of the universities that are providing the training. We also are focusing on working with districts and schools with high needs and to recruit and retain DPI licensed school-based mental health staff. We also are working with tribal leaders and communities to recruit and retain school-based mental health staff that serve members of federally recognized tribes. And last but not least, we are focusing on increasing diversity within school-based mental health professions. Which leads us to our timeline. So we were awarded the grant at the end of October, and with the beginning of 2022, the first phase of this project, we really focused on partnering with University of Wisconsin Pupil Services programs. We wanted to address high student to pupil service professional ratios and staffing shortages in school districts across the state. And we learned that it's essential for us to build an infrastructure that makes these licensing programs accessible. Therefore, the first phase of this project is focused on the planning and contracting with partnering University of Wisconsin programs to remove barriers for prospective students and increasing that access, to increase enrollment as well, and the number of trained school-based mental health professionals that are prepared for enrollment in school districts across the state. Which then leads us to our second phase, which is the phase that we're in now. We want to partner with our selected school districts. And again, I mentioned that school districts were selected based on need, and we want to recruit and retain pupil services professionals within these school districts. We want to plan and develop a subgrant to recruit and retain school-based mental health professionals that live and work in the community, because we know if they live in the community, they're more likely to stay in the community and then stay within their profession. This brings us to our rationale, and I mentioned that we would dive a little bit deeper into our selection process. And in order for us to select school districts, we really wanted to focus on using a priority criteria instead of a competitive application process. We believe that this will increase the likelihood of identification of school districts based on need and basing that need from multiple data sources rather than applicant skill for writing applications. I also want to mention that all public school districts across the state, regardless of enrollment, were considered. And again, this selection process was based on need and data, which leads us to how we identified this need and contacted your school district. Districts were selected because they demonstrated or met some of the following criteria, including high student to provider ratios, which means the number of students to school mental health staff, including school counselors, school social workers, and school psychologists, a history of unfilled school-based mental health positions, serving a significant number of students from Wisconsin tribal nations, disparities between cultural, racial, ethnic, and linguistic diversity of staff when compared to the student population. Districts that met this criteria are being provided this overview of the School-Based Mental Health Professionals Project so that we can highlight this tremendous opportunity to recruit and retain school-based mental health staff within your own community. Which brings us to our focus of participation. District participation in this project can focus on the recruitment and retention of pupil services staff that work and live in the community. You may hear me referencing in this presentation, grow your own, and that's what I'm referencing. Identifying individuals that are interested in pursuing licensure and are living and working within your district or within your community. Additionally, our University of Wisconsin partnerships will also provide a channel to recruit and place trained school-based mental health professionals in communities where perhaps interested professionals historically have had barriers to attending face-to-face instruction in a partnering program. So if you have experienced challenges hiring or perhaps keeping school counselors, school social workers, or school psychologists in the past, funds from this project can support and assist in the recruitment and retention efforts in your district. Which brings us to commitment. Your district has been selected to be a part of this opportunity through a sub-grant, and the commitment of participation includes the following. There is a 25% match of the sub-grant funds. This may be in kind. Also know that this is a one-year grant and there will be the opportunity for renewal each year. Also, quarterly reporting will be a part of this process and you'll be working directly with me. And during these meetings, we'll be discussing your progress towards goals, any challenges that you've had, successes, and also we'll be problem solving together. So it's truly a collaborative effort. And also, funds that are provided through this grant are meant to be used to increase sustainable retention and recruitment of school-based mental health professionals beyond this project. So I'd like to share some examples of how the sub-grant funds may be used. You may be able to use the funds for planning, for recruitment, marketing, or even stipends for education. Stipends may be used for professionals that you know that may live or work in your community that are interested in pursuing a school-based mental health profession, whether that's being a school counselor, a school social worker, or a school psychologist. Also, the funds may be used to remove barriers for working professionals that may need additional support to complete training in a pupil services field. That may look like providing classroom coverage. Maybe you have a teacher that's going back to school. You can use those funds to provide coverage. And then also I would like to highlight how the funds are not to be used. So one of the things that I'd like to point out is that although you want to recruit and retain school-based mental health professionals, the funds from this subgrant are not to be used to pay the salary of these positions. However, it can be used to support the planning, recruitment, and marketing so that you can build capacity within your district to hire and retain school-based mental health professionals. So for instance, you can use funds to identify an individual to coordinate this project in your district through recruitment planning, market analysis, and building a sustainable infrastructure to increase pupil services staff. You may use sub-grant funds for community planning to identify community incentives such as childcare, gym memberships, with a focus again on that grow your own, finding individuals within your community that are likely to stay within your community. Identifying professionals that are interested in becoming licensed. You can also use the funds to help pay for tuition and other costs related to training. Additionally, you may use funds for sign-on bonuses. So for instance, if recruitment's been a challenge, sign-on bonuses may increase your applicant pool. The intent is to use grant funds to create a pathway to continue the recruitment and hiring of school-based mental health professionals beyond the duration of the sub-grant funds. So this brings us to our next steps. You are watching this overview because it was emailed to all directors of pupil services programs that were selected. And in that email was not only the overview, but also a Google form. We encourage directors of pupil services to share that email with any stakeholders that may be interested in being a part of this project. And in return, we ask if you are one of these stakeholders that you please watch the overview first and then fill out the Google form. The Google form will be used to assess interest in participation. Once I identify our interested districts through the Google form, I will be following up to schedule one-on-one discussion sessions. And when I say one-on-one discussion sessions, it can certainly include any stakeholders within your district that would like to be a part of that conversation. Also, I'd like to point out that if you've watched this overview and you're still not sure whether or not you are interested in participating, or perhaps you have some questions, that's absolutely understandable. Please indicate that on your Google form, because these one-on-one stakeholder discussions are intended to address your individual needs and hopefully clarify so that you can make an educated decision regarding your participation. I'd like to thank you for taking the time out of your busy schedule, especially during the pandemic and all of the stresses that I know that our school districts are experiencing right now. I appreciate you taking that time. And I also would like to thank you in advance for taking time to fill out the Google form. If for any reason you have additional questions, you can always reach out to me. My name is Karen Horn, and I can be reached at Karen.Horn, so that's HORN, at dpi.wi.gov. I'd like to thank you again, and I hope that we hear from you so that we can continue this collaboration.